neurosurgery in the Pacific Northwest didn't exist until right after World War I. And how that happened to be was that there was an ear, nose, and throat fellow in Tacoma who was taken into the service, and neurosurgeons just were very few and far between. So what they did was they took some people who had surgical experience and they felt were adept at it and gave them a short course in neurosurgery. And I don't know how long it was, but probably less than 3 months. And they were then taking care of the injured troops and so forth during World War I. And Swift was trained in that fashion and came back to the area and was the only person doing neurosurgery. And then Bud Behrens came on the scene about 1932. And Bud had a preceptorship, apparently under Dr. Swift. He was not trained as a neurosurgeon per se, except in that preceptorship kind of basis, where he learned from his mentor. And so Bud came along and he was a very humble person, a very nice person, and he kept trying to advance the field of neurosurgery, and he did so by incorporating many things into the field, such as electroencephalography. And he did have, later on, prior to 1950, he had no partner except for some associates, I think, and I'm not clear on this, but there were two neurosurgeons by the name of Dr. Paul Floto and Hunter McKay, but they were pretty much independent, I think, for the most part from Bud. When World War II started, Hale Haven was a neurosurgeon at the Virginia Mason Clinic, and Hale was one of the, I think, founding members of the Harvey Cushing Society. And when World War II came along, he had to go. He was conscripted into the service. And Bud Behrens was the person who was covering Virginia Mason at that time, as well as his regular practice. In addition, Bud was the county coroner, so that he was responsible for all things that had to do with deaths and so forth that needed investigating. And there was, of course, many tales that he could tell about that were most interesting. But Bud was on his own, and he described things at the Virginia Mason. He was stretched pretty thin. But if he had to do some diagnostic tests at the Virginia Mason, they would line him up. And air studies was kind of the name of the game in those days, so that people were always getting pneumoencephalograms, or in case of tumors, ventriculograms. But the pneumos, Bud would be going to Virginia Mason into the radiology department, and he'd have his 6 patients sitting in chairs with their back towards him, and he would stick a fairly large bore needle in their back, probably an 18, and then the spinal fluid would drain out. He'd go from one to the next to the next, so we had all 6 of them draining spinal fluid. And then he'd go back to the first one and start injecting air with a 50 cc syringe. Needless to say, it's hard to imagine what that must have looked like in the scene, because everybody, I'm sure, was vomiting and so forth, and trying to get x-rays must have been, a most interesting process. But that was the apparent need, because who else was going to do anything at that time? Bud, I don't think he had much association with Paul Floto and Hunter McKay. They were, I think, probably, to say it gently, they were pretty flamboyant. And Hunter McKay and I worked at the same hospital initially. That was several years before he died. And he had his own practice, but I don't know how well he was regarded in the community as a whole. But Bud got in after the war, carried along his practice. Hale Haven came back,